Good morning. You are very welcome to join us here today for our launch of the Innovative Health Initiative, building on years of experience with the Medicals Initiative, but it's a new step forward into a new era. So we're going to be discussing that over the coming hours. I've got some great guests lined up who'll be able to answer your questions and look at what's going to happen. My name's Jennifer Baker. I'm a policy journalist based in Brussels, and I'll be guiding you through today's events, but we do rely on you, the audience, to give us your thoughts, your questions and your input. So please do use the tools at your disposal on the screen to engage with our speakers. You can use that Q&A function you'll be able to see alongside you on the screen. So this event, it's celebratory. We're going to talk about why things are moving forward, about the new advances in technologies that are bringing us into the new era. And of course, hopefully bouncing back better from the COVID pandemic and using everything at our disposal to make the next decade a success. So let me start by asking you, the audience, to tell us a little bit about who you are, get you warmed up and using that poll function tool. So who are you? What organisations do you represent? We've got a lot of different options for you there. You could be academia, you could be from one of the policy institutions, you could be an NGO or an agency, a healthcare practitioner. Use that tool, tell us who you are so we know what you're going to be most interested in. Now, it's worth noting that what we are talking about today is the biggest public-private partnership in life science research. So we know that you represent all sorts of different organisations and we want it to be fruitful and interesting throughout the morning. Now, IHI, which is not the Irish Health Initiative, despite my accent, it's the Innovative Health Initiative. It doesn't start from scratch, of course. It builds and stands on the shoulders of giants who were involved in more than 100 IMI projects, some that will continue on into the coming years until 2027. But it's not just about pharma, it's about medtech, it's about all these other elements and these exciting things that we're looking towards us. So we're going to have a couple of keynote speakers to start things off, telling us about the how and the why and the details of IHI. And then we'll take a short break to allow you to get some coffee, and then we'll come back with a panel with lots of key speakers representing different bodies. So really trying to bring everyone together into one big conversation this morning. And you have the opportunity to ask questions of both our keynote speakers and of the panelists later on, who will be bringing in also policy elements as well to the discussion. Now, I'm having a look at the results of this poll. We asked who you represent. We've a lot of people representing academia and universities, around 28% of you. Industry, again, a huge chunk, more than a fifth of you representing industry. Research bodies, small and medium-sized enterprises, also well represented. And a smaller number, but a significant smaller number representing public administration, whether that's at national level or EU level. So thank you for that. Keep your fingers busy. Keep your tablets and your phones and your laptop to hand to ask questions, because we're going to hear, first of all, from Pierre Meulien, who's the Executive Director of IHI, and then from Hugh Laverty, who's the Head of the Scientific Operations. Both gentlemen will be giving you the take on why IHI is so very important. So we're going to start. Pierre, I'll invite you to take to the podium. We will hear what's changing, why, what's staying the same. Give us the lowdown, Pierre. The floor is yours.
Thank you very much, Jennifer, and good morning, everyone, and welcome to the launch of the Innovative Health Initiative. I know we're once again in this kind of virtual world, which is a shame, because it would be nice to see some warm bodies in a big room. But we do have 2,600 people registered for this event, so as they say, no pressure. So look, this IHI is a new public-private partnership. It builds, of course, on the 14 years of experience with the Innovative Medicines Initiative. And IHI strives to be more inclusive, integrating sectors well beyond the pharmaceutical industry, including diagnostics, medical imaging, medical devices, and everything, of course, digital. This is necessary to both accelerate innovation for the benefit of European citizens and to help maintain the industrial competitivity of the European healthcare industry sector. So why do we need public-private partnerships? Well, there are some huge challenges that we need to address as a society, and they require joined-up approaches across the public and private divide in order to make progress. And we've learned through IMI what kind of projects are good fits for public-private partnerships, and they can be grouped into several categories. First of all, true market failures. This has been typified by antimicrobial resistance, where there's all of the normal rules of the market don't apply. Complex scientific areas like neuropsychiatric disorders, where it makes no sense for single groups to be working in silos. Finding new clinical and regulatory pathways for innovation. Developing tools and data sets that can be made available to everyone, that can be used to accelerate research in a particular field. And of course, we've been working in the past on a lot of gaps in crucial pieces of infrastructure, whether it be in pediatric clinical trials, the use of medicines in pregnant women, high throughput screening platforms, big data projects, of course, all of this. Now, we all know that the healthcare ecosystem is extremely complex, and it's important for Europe that we strive to have the most modern healthcare systems that are financially sustainable, that embrace the latest innovations, and that these innovations are made accessible and affordable to as many EU citizens as possible. Now, these words are easy to say, but very challenging, as we know, to implement. And that's why we need to build public-private consortia that involve all of the necessary actors that allow innovation to occur and get this translated. We have to ensure that the amazing research developed in our universities, research institutes, research-intensive hospitals reach the greatest number of citizens possible. Now, there are a lot of drivers that are in play here and that we need to take into account when addressing the major challenges. The first one, of course, is the science and technology, and I include all aspects of science and technology, including digital here. And we do not have an efficient process, let's be honest, for ensuring that the new knowledge and tools are taken up by health delivery systems. And there are loads of examples here. We can think of the stratification in cancer, stratification in asthma, stratification in diabetes, where we know that these diseases are not just one disease, there are many diseases. And we know that patients could really have a huge advantage if tailor-made treatments were matched to the stratification. And we can do this, we have done this in IMI project, but we have not been able to scale it up so that all of the European citizens can take advantage of this. So through public-private partnerships, we can accelerate this translation from laboratory to use into health delivery. And we need connected thinking from the very beginning so that we avoid any dead ends. So then, of course, the second big area is in regarding the epidemiology of disease. And the world has just gone through an earthquake because of the global pandemic. And this has turned priorities on their heads. And it's very now, one of the learnings is that both infectious and non-communicable chronic diseases need to be managed and prioritized in a joined-up thinking manner. And that's a very important driver for us to think about when we're developing the IHI program. The role of the patient, of course, and the citizen, because all of the citizens become patients at some stage in their lives, in the priority setting of the agenda is crucial to get populations on board when tough decisions need to be made. I mean, for example, when we need to mobilize public opinion to prioritize preventive measures or early detection of disease that could make huge economic sense long term, but very challenging to implement and prioritize in the short term. And this leads, of course, to everything around the healthcare economics, so that we can address the ways in which value judgments are made, and keeping populations healthy, and who gets involved in those judgments and who gets involved in that prioritization. And without prevention, early detection, and disease interception strategies being integrated into health systems, we will not create sustainability. So public-private partnerships can accelerate knowledge creation, reduce bottlenecks, and increase the efficiency with which systems can take on innovation. And in our model, and this was true for IMI, remains the case for IHI, we focus on the pre-competitive space. And this is where industry partners collaborate, share ideas, knowledge, data with each other and with, of course, the public sector in order to speed up development of innovative solutions. And we can see a general shift happening in the competitive space. Now, people often ask me, can you define the pre-competitive space? Well, it changes over time, and it changes depending on the disease area that one is looking at. But in general, the pre-competitive space is moving downstream of early stage research to a place where we can work on things that benefit the whole field rather than individuals, once again, working in silos. And this model also obliges end-to-end integration of thinking that will ensure that we do not either reinvent the wheel or end up at a dead end. And it means that IHI projects will include not only the great researchers and clinicians from our universities, hospitals, and industry partners, but very importantly, they will include regulators, patients, health economists, and any other relevant stakeholders that can accelerate uptake of innovation in health systems. And of course, collaboration is the key and has always been through these public-private partnerships. And the former Commissioner of Research and Innovation, Carlos Moedas, coined the term radical collaboration when he was describing what IMI was doing and driving and at the cutting edge of. And IHI will continue to be at that cutting edge of radical collaboration. So as you can see, IHI will share a lot of the same philosophies as IMI, but we will have some very significant differences too that I want to highlight right now. The first major difference is in the makeup of the governance and thus the strategic direction of the partnership. And we're thrilled to welcome IHI's founding partners. They represent the widest range of both industry sectors and public policy domains that has ever been put together worldwide, and at a scale that can and will, through IHI, have major impact. So on the industry side, the governing board will have representatives from all of the most important industry associations in the European healthcare sector: COSIR, FPA, including Vaccines Europe, Europa Bio, and MedTech Europe. And you'll hear from all of them in the panel later on. Integrating these sectors in IHI will, of course, take advantage of the technology convergence that's ongoing right now, but needs to be accelerated and joined up. Just look at what's happening in the field of personalized medicine. The co-development of diagnostics, digital tools, and medicines will redefine how many aspects of healthcare are delivered. Very significantly, we also have on the public side governing board members from 4 different European Commission Directorate Generals: DG RTD, DG GROW, DG Santé, and DG Connect. This joined-up approach taken by the European Commission has been spearheaded by Jean-Éric Paquet, the Director General for Research and Innovation, who you will also hear from later on in the next session. So in order to implement this new partnership, we have a brand new Strategic Research and Innovation Agenda, or SRIA, and this has already been adopted by the IHI Governing Board and now posted on the IHI website as of yesterday. It will be implemented under the guidance of the IHI governing body, but helped by another very significant novelty, the Science and Innovation Panel. Now, the Science and Innovation Panel will be a critical advisory board and will be comprised not only of world-recognized European scientists, but also representatives of the wider healthcare community. This includes patients, regulatory expertise, health economists, and so on. They will be joined by representatives of founding partners, which will ensure a consistent alignment with the Strategic Research and Innovation Agenda, and very significantly, 2 members of the new States Representatives Group will also join as permanent panelists. The Science and Innovation Panel will therefore play a central role in making recommendations to the Governing Board on what research themes we should launch as calls for funding during the life of IHI. And my colleague Hugh Laverty will explain in more detail in a minute if you'd like to get involved in this panel. The States Representatives Group that I just mentioned will itself have an increasingly important role in monitoring and giving input into the programme and will undergo significant enlargement. There are also certain stakeholder groups that we would like to focus on bringing on board in IHI. The first one is the SME community. In IMI, we had over 300 SMEs involved in our projects, But given the enlarged scope of IHI and the types of technologies that we could develop, we have more ambitious goals in terms of SME numbers for IHI. And we hope to increase this number significantly. The second area of focus is the Eastern European countries. Now, I've visited many of these countries over the past 6 years of IMI and have met some incredible scientists, clinicians, and SME entrepreneurs. I've always maintained that there's no reason why their involvement should be lower than from other parts of Europe, and we will use as many mechanisms as we can to make IHI attractive to all Europeans. The last word, and perhaps it should have been the first word, is in regard to patient involvement in IHI. Again, we will be building on the amazing journey we've had in this regard in IMI. And I have to mention one IMI project here, which is, of course, UPATI, the patient academy that was built during a long period and is now has its own sustainability, is the UPATI Foundation. This project not only transformed how patient engagement works, but also went pan-European and beyond in its reach. It developed educational toolkits for patients that has been translated into 13 languages and has been accessed by over 4 million EU users. The UPATI platforms have been replicated in over 23 European countries, and 2 years ago, a UPATI-inspired platform was developed in Japan. So it was with little modesty that I like to think that IHI, the new public-private partnership, will be at the cutting edge of patient involvement. A new patient engagement strategy for IHI will be developed within this year, 2022, and we will continue to involve patients at every step of the project lifecycle. We will find ways of involving patients more significantly at the very beginning when ideas are being generated and discussed, and I know that this is a high expectation from their side to be involved in that early on in that idea creation process. IHI will be indeed a public-private partnership for EU patients, and the journey will continue. I just want to finish by thanking the European Council, the European Parliament, and the IHI Governing Board for all of the work completed over the past 2 years, which is now being translated and, as Jennifer said, celebrated at this launch event. And now I'm going to pass it over back to Jennifer for the next piece. Thank you.
Thank you very much, Pierre, for setting out all of our aspirations and the aspirations for IHI. You mentioned there quite a few different areas where people can get involved, and I also want to encourage people to stay getting involved online. I'm keeping an eye on what's happening on social media, so you can, of course, use the hashtag #WelcomeIHI. And remember, we're going to hear now from Hugh Laverty, who is the Head of Scientific Operations, who can answer in a lot of detail your questions. So please do send those in. We'll take a pause during his presentation to check whether you've got questions for him. Of course, he will be telling you about that Science Innovation Panel as well as many other points. So with that, Hugh, I'm going to hand the floor over to you. We look forward to hearing all the details.
So thank you, Jennifer, and thank you, Pierre, for the introduction. I have a very nuts and bolts presentation for you, so I'm going to go into lots more detail on some of the things that Pierre has already introduced to you. I'm going to touch a little bit on what is IHI, and Pierre has done a very good job at introducing the why. I'm going to explain a little bit how we will operate, spend a few moments on our strategic research agenda, and also how you can get involved in terms of helping to shape the agenda, either through engaging and getting involved in the Science and Innovation Panel, getting involved in our evaluations or our project reviews, joining the patient pool, and I'll also say a few words about how you might become a contributing partner if this is of interest to you. I am sure many of you are very interested to understand not only how we are going to run the funding programme under IHI, but also when we will start that. And so I will give you a few indicative timelines as well. And very importantly, we are in a phase of transition. So we have established IHI. We have many things that we're working on to put in place that we will need to implement the programme. And of course, we will put this information into the public domain when it becomes available, and I'll explain how you can keep up to date with that as well. Now, I don't want to dwell on this slide too much, but this represents a lot of what Pierre has introduced. The key thing to remember from this slide is that we are a collaboration between the EU and a much broader range of industries, the biopharmaceutical, biotechnology, digital health and medical technology industries. We build upon our success that we had under both IMI1 and IMI2, but the goal is to build a new programme that will be focused on interdisciplinary, sustainable, patient-centric health research. And of course, why we fund our projects is that we want the results to eventually transform patient lives. Pierre has introduced our new partners, and we're particularly happy to be working with so many new industry associations and types of industries as well. And there are a couple of elements that Pierre has touched upon in terms of what's new, and I'll say a little bit more about that in terms of the way in which we're governed, and the fact that our objectives are very aligned with the EU's latest health policy strategies. Of course, we are a PPP, so some things stay the same. So we are still an implementing body, so we execute our programme by running calls for proposals and launching projects. And our funding comes equally from the public and private sector. We are still a matched funding model. We run our calls for proposals. They are open and competitive still. And the IMI projects have not disappeared. They're still there, and we bring them under the umbrella of IHI. Now, regarding our strategic research and innovation agenda, just at a very high level, the focus of our new research and innovation agenda is this approach of cross-sectoral approaches to facilitate creation of new products and services that we hope will prevent, intercept, diagnose, treat and manage diseases. And the goal with the IHI is to lay the foundations for the development of safer and more effective healthcare products, particularly in those areas where there is an unmet public need. And of course, we want solutions and we want new ideas and we want new products that will actually be implemented into the healthcare system. Very broadly, we have a set of high-level objectives that are laid out in the legislation that created IHI. So our general objectives are to turn health research and innovation into real benefits for patients and society. We're looking to deliver safe, effective health innovations that cover the entire spectrum of care, particularly in areas of unmet need, as I just mentioned. And we want to support European industry. So we're looking to make European health industries globally competitive. Now, I apologize for this very busy slide, but these are the specific objectives that IHI has, and they're set out in this strategic research and innovation agenda. And it is expected that the IHI programme and the projects that we fund will generate the results and the impact that are going to improve our understanding of the factors that affect our health and the development and treatment of diseases. We are looking to integrate fragmented health research and innovation efforts by bringing together the different health industry sectors and other stakeholders. We're looking to demonstrate the feasibility of integrated healthcare solutions that will draw upon the different technologies that are available in the different sectors and will address the needs of people who use them, particularly patients and healthcare professionals. And of course, we are awash with data, so we need to make better use of opportunities to gather the health data and use it in research and care, and particularly while respecting privacy. And to finish with, we are looking to develop ways of assessing the value of innovative integrated healthcare solutions to patients, carers, healthcare professionals, and organisations and stakeholders. And so for those of you who have been used to us talking about IMI1 and IMI2 for the past 13, 14 years, you will already see that in our objectives that the ambition and the scope of IHI goes way beyond what we were doing in the past. Not only are our projects in the programme expected to deliver results that are going to address the objectives set out in the SRIA, it's very important that our projects contribute to other EU policies, and these are listed here. Now, it's obvious that we should contribute to Horizon Europe because IHI is part of that programme. But it's also expected that we will, and our projects, will contribute to Europe's Beating Cancer Plan, the New Industrial Strategy for Europe, the Pharmaceutical Strategy for Europe, and the European Health Data Space. As I mentioned before, we will continue to implement the programme by launching calls for proposals and then selecting projects for funding. And of course, these projects will have to be aligned with reaching one or more of the objectives as set out in our strategic research and innovation agenda. To do this, we're going to mobilise a lot of funding, and we're very fortunate to have 1.2 billion euros provided by the European Union. This will be matched by 1 billion euro provided by the member industry associations, and we will have 200 million euro that may come from contributing partners. And I'll say a little bit more about them later. I think we've stressed on several occasions now that we are learning from the lessons under the Innovative Medicines Initiative, but it's important to remember IHI is not meant to be a direct continuation of IMI. Rather, we're looking to use the results from IMI projects, the ongoing initiatives and platforms that may have been established, but to integrate these within a new platform with a broader scope, more partners, and a wider stakeholder base. And of course, we are not an island. We do not work in isolation. It will be really important that IHI establishes or seeks and establishes synergies with other Horizon Europe activities, but also other national and European programmes as well. Overseeing IHI, we have a governing board, and the structure is shown here. Our governing board is composed of representatives coming from the European Commission, as described by Pierre, but also representatives coming from the trade industry associations, CACIR, Europa-Bio, FPA, including Vaccines Europe, and MedTech Europe. They will oversee the work and give direction to the IHI office, and the IHI office will be the implementing body by which the programme is set up and run. There are two important advisory groups supporting the work of both the governing board and also providing feedback to the IHI office. These are the State Representatives Group, which Pierre has said a little bit about already, and also a new panel, our Science and Innovation panel. So I would like to spend a few moments introducing what the Science and Innovation panel is, and also highlighting how you might be able to join this panel. It is obvious that in order to execute our programme, we're going to need input of different types, both scientific and technological, but also this input needs to come from a wider range of stakeholders, and particularly those involved in healthcare systems. Because as I said before, it's very important that whatever we produce, whatever the projects generate, they are actually addressing the needs of healthcare systems and patients. So the stakeholder input will be provided amongst others by the Science and Innovation panel. So the Science and Innovation panel's role is to provide this advice to the governing board on scientific and technological matters, feeding into our draft work programmes and our draft call topics, updating our SRIA whenever it needs to be updated, the planning of additional activities when these are identified. If we need to set up advisory groups for specific scientific challenges or priorities, they will play a role. And of course, they will help us in identifying those synergies that I mentioned with other parts of Horizon Europe, but also more widely at national and European level. The composition of the Science and Innovation panel is shown on this slide. There are 18 permanent panel members. 2 come from the European Commission, 4 members come from the industry partners, and 2 members come from the State Representatives Group. We have 4 members that will come from the scientific community and six members that will represent stakeholders involved in healthcare. The chair of the Science and Innovation panel will be elected by the other panel members, but it's important to understand that the chair will come from one of the 4 members representing the scientific community. Now, we might be able to add ad hoc panelists to the SIP, and this really depends on whether we have specific subjects that we need specific expertise, but that will be decided on a case-by-case basis. In terms of who appoints the representatives to sit on the Science and Innovation panel, for the European Commission, the industry representatives and the state representatives group representatives, they are appointed by their own body. However, for those members coming from the scientific community and the stakeholders in healthcare, these representatives will be appointed by a call for expressions of interest that we have launched, and you can find details on our website. And we launched it on Monday the 24th of January. What we are looking for from the representatives of the scientific community is that they should be able to provide the necessary know-how in a scientific or technological area or areas relevant to IHI's objectives. And the healthcare stakeholders should bring the knowledge and experience and in at least one of the following categories. So patients, healthcare professionals, healthcare providers, regulatory bodies, health technology assessment bodies, and healthcare payers. The call for expression of interest will establish a list of candidates for the IHI Governing Board, and the selection process will be based upon the essential and advantageous criteria listed in the call. The IHI office will validate the applications that are sent in, and we will prepare, based upon the essential and advantageous criteria, a list that will be sent to the Governing Board, and it will be up to the Governing Board to finalise and to appoint the panellists. Of course, ensuring a high level of expertise and balanced representation, ensuring we address things like geography, gender, and other issues like that, so that we end up with a very balanced panel. It's important to remember that if you are selected to be a permanent panellist, you will be appointed in your individual capacity for a term of 3 years. Regarding those essential criteria, all candidates need to demonstrate that they have knowledge and experience in providing advice of scientific and technical quality in areas relevant to IHI objectives, and the working language of the panel and the office is English, so you should have a very good command of written and spoken English. For those representatives from the scientific community, it's essential that you prove and demonstrate your competence and expertise in health research and or healthcare in those areas that are relevant to IHI objectives, and this should be supported by a university qualification. In terms of the essential criteria for representatives of healthcare stakeholders, you need to demonstrate competence and expertise in representing stakeholders involved in healthcare for at least one of the aforementioned categories that I had listed before. And you also need to show that you have the support from one or several organisation groups or networks representing the interests of relevant stakeholders at European or international level. In terms of the advantageous criteria, it would be very good if candidates were able to demonstrate a record of previous participation in scientific and technological advisory bodies. Of course, a good understanding of the EU research and innovation environment, a good understanding of the industrial research and development environment, a scientific impact of relevance to areas of the IHI activities, and this probably applies more to those coming from the scientific community. And of course, it would be an advantage if you've already got experience of cross-sectorial experience and expertise. Now, it's very important to understand that we need the members selected for the Science and Innovation panel to be able to act independently. So they should not have financial or other interests in health-related industries which could affect their impartiality, and they undertake to act in an independent manner. It's very important to understand that if you join the Science and Innovation panel and you are selected to sit on the panel, you shall not participate in proposals or projects funded under the IHIJU, either in your personal capacity or as a representative of an organisation. And of course, when we have discussions within the panel that might impinge upon an organisation you're involved with, you should inform the office, you should inform the other panel members and step out of the meeting at that point while those issues where you may have a conflict are being discussed. Now, I've just given a very brief introduction to the Science and Innovation panel. There's a lot more information. The application form and list of documents that should be included in any submission are available on our website, and the link is shown here. Candidates can apply for one or both positions, but please remember that if you apply for both positions and you're in the lucky position to be able to do that, and you are selected to sit on the panel, it's the governing board that will decide the final position offered. We launched the call on Monday, and the deadline for submission of applications is on the 21st of February of 2022. So if you're interested, please go to the website and good luck with your application. Now, in addition to the work that we do in the Science and Innovation panel when it's established, we actually run a lot of evaluations and project reviews. And so you can still get involved in our work and help us by becoming one of the external independent experts that we rely on to evaluate the proposals submitted at calls and to check up on our project performance. So if you have a high level of expertise in fields relevant to IHI, please register at the Horizon Europe Funding and Tenders portal and let us know that you would like to take part. For those of you that already have a profile and you haven't visited in a while, please go and make sure that it's up to date, because as we're going to have much broader topics in our calls, we're going to need a much broader range of expertise. So we want to be able to find you. In addition to acting as an evaluator or an expert on our project reviews, there's the opportunity to also support us by acting as an independent observer for our calls. Now, the role of the independent observer is not to actually assess the proposals that are submitted. They support us by actually checking the work that we do in the IHI office. They make recommendations, they make observations, they get feedback from the independent panels of experts, and they put that in a report that we actually publish on our website. So all of the independent observer reports from previous calls are available for you to read. If this is of interest to you as well, then please make sure you've registered in the portal and let us know that you would like to be willing to take on this role. Pierre touched upon this in his presentation as well, and I just want to remind you that under IMI2 we actually established a patient pool. And we established this patient pool to try to get patients more involved in our activities at both a strategic and operational level. And drawing from this pool, we were able to involve patients in some of our evaluations, our project reviews, our closeout meetings, webinars, and it was really beneficial to the programme to have their voice and to have patients and carers involved. Now, the patient pool still exists and it's still working. It's currently closed for applications, but we intend later in the year to reopen the patient pool. So again, if you would like to get involved in our work and you are a patient or a carer, I would recommend that you have a look at the patient pool, and if you're interested, apply. And of course, when we reopen the pool for new applications, we will put that information on our website and into the public domain. So my final slide regarding how to get involved in IHI actually relates to those organisations that might want to take part in setting the agenda but don't actually want to become full members. So this category of contributing partners was again created to help widen the range of health stakeholders. The way in which contributing partners will contribute to IHI is that they will invest their own resources or cash in a specific IHI project or projects, and their contributions work in a very similar way to industry partners in terms of it's counted as in-kind contribution. This is a lighter way to get involved with the programme if you're an industry or a charity, because your responsibilities stop with the project. They don't actually go across the wider programme. Under IMI, we ran the same programme but under the name of Associated Partners. And under IMI, we were able to attract over 30 associated partners from around the world, including philanthropic organisations, patient groups, companies who participated in our projects and committed over €200 million of in-kind contribution. Any international organisation or legal entity can apply to become an IHI contributing partner, and of course there's a process to go through when you apply, and that your participation will ultimately have to be endorsed by the IHI governing board. If you're interested, please feel free to contact the office and we can talk you through the process. Okay, so I think that's I've covered a lot of ground, and it's a natural place to take some questions if there are any, Jennifer.
Hugh, there are a lot of questions, I can say. And one I can answer straight away, which is a lot of people are asking if Hugh's slides will be available. And the answer is yes, the slides and a recording will be made available online after the presentation. So if you can't follow everything in real time, don't worry, we'll make sure it's there. Some of the questions I think you may have answered. We have Julia Nordin asking how patient organisations can get involved in the IHI partnership concretely. I think you touched on a lot of that. Is there anything else that she should know?
Well, I will come on to that in the second part of my presentation where I talk about calls. So of course we would like to see patients represented on our science and innovation panel. We have the patient pool, and of course when the topics are relevant, we would encourage patient organisations to actually apply as a consortium and receive funding as well.
Another question is, are the calls bottom-up or top-down in approach, and where can people see the open calls?
So I will touch upon that in the second part of my presentation, where I touch upon all of those points.
Okay, there's another question regarding the IMI and the ongoing projects that are still there. What's going to happen to them? And another question, is it a kind of evolution, or will the two be maintained alongside each other for a while? This is a couple of questions on this topic.
So in terms of IMI, we still have over 100 projects that we are supporting from the IHI office. The idea is that the IMI projects continue. The responsibility for looking after those projects actually passes on to the IHI office. So many of us that were in IMI, we're now in IHI as well. So there's a continuity in the way in which we manage the projects. What doesn't change are the rules, the grant agreement that was put in place for the IMI projects. That is maintained. All that really changes is that the badge of IHI regarding IMI projects. Regarding will they exist in parallel, I think one of the things that we need to do within IHI as we get up and running will be to actually begin to integrate the results coming out of IMI2 projects and the different platforms and initiatives, and begin to build on those within IHI. So while the grant agreement and legally they may be quite separate, you can see that there will be a type of evolution in how the results, dissemination and exploitation might be managed.
We also have several questions from people asking about whether researchers in the UK, Switzerland, the US, so beyond the EU, can get involved and get funding. Okay,
so I will be speaking, and my answer will be checked by the lawyers in the IHI office. So there is a process of association going on between these third countries and the European Commission. It is foreseen for those of you that are in the UK or in some of these third countries that you can still apply to open calls under Horizon Europe. and you can still go through the whole process. I think what is really key is that the association agreement has to be in place before grant agreements will be signed. So currently, if you want to get involved in IHI and you're in the UK, you can. I think the UK government also may have a scheme in which they're going to provide funding or some sort of backup funding as a contingency. But the bottom line will be that there will need to be an agreement, an association agreement in place before we sign a grant agreement.
For this point, I'm going to just one or two questions on the science innovation panel. A question here is asking is if one takes place in the SIP, does that preclude them from getting funding in other programs or projects? And a couple of questions again, just on when they will be meeting, what is the timeline regarding the Science Innovation Panel? Okay,
so it's very important to understand that if you take part in the Science and Innovation Panel, you can't participate in IHI projects. You won't be able to apply for funding. But this does not preclude you taking part in other initiatives under Horizon Europe. It's simply for IHI. Regarding the timing, things are a bit fluid because IHI is quite dynamic, so we're working quite hard. We hope to be able to complete the selection process for members of the Science and Innovation Panel very quickly. So that would be in early March, and be able to constitute and have our first meeting of the Science and Innovation Panel end of March, beginning of April. It's very important to understand that actually the questions related to call topics and topic development, the Science and Innovation Panel plays a very, very important role in this. So actually it's incumbent upon us to get the Science and Innovation Panel up and running as quickly as possible. So I think you will get the impression that we're moving quite quickly on this.
Well, there are still quite a few more questions. We will put them to Hugh, and indeed, don't forget, Pierre is also here to answer some of your questions. But I'm going to give the floor back to Hugh to give you a little bit more detail. But do keep the questions coming in. We will get through as many as possible.
Okay, so thank you, Jennifer. Now, on to call and evaluation planning, which I'm sure from the questions we've already received, many of you are interested in. As I've said already, the IHI will implement its programme through calls for proposals and the funding of projects. We will bring forward a range of single-stage procedures and two-stage procedures. It's envisaged under IHI that we will actually have more single-stage procedures, and for those of you who know, single-stage is more bottom-up. There's more flexibility in the applications that you can submit in response to a call. So this would be a bit of a change from the previous programs in terms that we expect more single-stage procedures, so it should be a bit more open, a bit more bottom-up. I've shown the workflow, and I'll just talk through this for both single-stage and two-stage. In terms of topic definition, for a single-stage topic, we will seek input from a range of different stakeholders and partners, particularly the European Commission, industry partners as well. And these will also go through the Science and Innovation Panel, hence the need for us to get the Science and Innovation Panel established as quickly as we can. Whenever we have stabilised the topic text, we will then go through a formal consultation process with the SIP itself, but also the state representatives group, and then we will get governing board approval for the topics amendment of the annual work plan and launch the call. Now, in response to a single stage call, applicant consortia should submit a full proposal. So this is the complete work plan. And it should come from a consortium that is full, i.e. it contains all the members needed to carry out the activity, both public and private partners. And there's an important element to understand in IHI that has changed from the previous programmes. It's now an eligibility criteria that in a single stage call, applicant consortia need to provide some in-kind contribution. And I will go into that in a bit more detail. We will follow the normal process in terms of our evaluations. So all of the proposals will be evaluated by an independent panel of experts. They will be scored and ranked, and the funding decision will be made. What will happen then is we will invite those that are successful or have been selected for funding into the granting phase. We will have the signature of the consortium agreement between the partners within the consortium, the finalisation of the description of action, and based upon that we will then sign the grant agreement and the project can launch. One important point that I forgot to mention is that in topic text development, it will be the IHI office that will be the pen holder. So we will actually lead the process in developing topic texts for single stage calls. Now this is a very similar schematic, a flow that shows the two-stage procedure, but there are a couple of very important differences. Again, the topic definition will involve consultation and discussion with the Science and Innovation panel. However, in a two-stage procedure, it will be the industry partners that will be driving the process. And why they will be driving the process is that it's very important that they're able to identify the in-kind contributions that they're going to bring into the final project. We will then, once the text is stabilised, we then go through a formal consultation, again with the SIP and the SRG. We launch the call after Governing Board approval. We invite applicants to submit their short proposals, and that will go through a panel of, through a process of evaluation, scoring, ranking with an independent panel of experts. And we will take the top ranked proposal. We will only take one proposal, the successful proposal, to the second stage. And we do this because at the second stage, we take the pre-identified industry consortium that were working on the topic text, and we merge them with the successful applicant consortium to build the full consortium. So this full consortium will then work on a full proposal, and the full proposal will go through another round of evaluation with an independent panel of experts. And if everything goes to plan, they will then pass into the granting phase. Again, it's the same process. We need a consortium agreement to be in place before we will sign the grant agreement, and then the project can launch. Now, in terms of who can participate in IHI, we're very aligned with Horizon Europe. So any legal entity or international organisation, regardless of its place of establishment, can participate in an IHI project. But please remember that if you're going to submit an application, you need at least 3 independent legal entities established in a different member state or country. And there's a new element that has been introduced under Horizon Europe, so please be aware of this. One of your legal entities should be established in a member state. Now, under a single stage call in IHI, we have a specific eligibility criterion. So it only applies to single stage call. It does not apply to the first stage of a two-stage call. And that is, as I mentioned, that costs related to contributions provided by participants shall amount to at least 45% of total project costs. So it is expected that applicant consortia to single stage topics will bring at least 45% in-kind contribution. It's important to understand if you do not bring 45% of your in-kind contribution, your proposal will be deemed ineligible and it will not be evaluated. So this is an important change under IHI that everybody has to be aware of. Regarding who is eligible to receive funding for single stage calls, actually it's very broad. So all non-profit organisations, academics, regulators, research organisations, public bodies and NGOs, everybody showing here. But even for-profit legal entities such as SMEs are eligible to receive funding, and also larger enterprises. Now, in a single stage call, you're going to have to balance those seeking funding and those bringing in-kind contributions. And I'm sure that some of the members of the the industry associations, they have already decided that they're not going to request funding, they're going to bring in-kind contributions. But if you're outside of the orbit of IHI and you're interested in participating and you want to get funding, that should be possible, even if you're a large enterprise. Where should these entities be established? Any legal entity established in a member state or associated country can apply, and new under Horizon Europe, entities established in low and middle income countries outside of the EU and associated countries, they can apply and receive funding. So again, this is new, and the list of countries that are considered low and middle income countries, you can actually find that list in the Horizon Europe programme guide. Regarding the funding rules for two-stage calls, again, it's slightly different because the way in which the call is constructed will be different. So again, non-profit organisations, academic institutions and for-profit legal entities, so SMEs, and larger enterprises with an annual turnover of less than 500 million, they will be able to receive funding. Where should they be established? The same rule applies. Any country or any entity should be established in a member state, associated country, or low and middle income country. And again, that list is in the programme guide. An important element to remember that in a two-stage process, members of the pre-identified industry consortium and legal entities which have a turnover of either more than 500 million or control or are indirectly controlled by another entity with a turnover of over 500 million, these cannot apply for funding. So pre-identified industry consortium members cannot apply for funding in a two-stage process. Now, I'm sure many of you are interested about our planning and when will we be launching our calls. So I've already mentioned that we hope to establish the Science and Innovation Panel in March and be able to get it to meet either the end of March or early April. Whenever they have met, we hope to be able to then publish draft topic texts on our website so that you can see what's coming down the line. In terms of our planning for our first calls under IHI, we're aiming for mid-June for launch of call launch, and with a single stage process we would expect full proposal to be submitted between mid and late September. We will run the evaluation in October and November, and we hope to be able to give the results to the applicants by the end of November. For those that are selected for funding, they will be invited to the granting phase and start work on their grant agreement, and we hope to be able to conclude grant agreement signature before March 2023. For a two-stage process, the timelines are quite similar at the beginning. Again, topic text into the public domain in April. Launch of the call mid-June. We're looking at a similar submission deadline at the end of September, but with a two-stage call, these will be short proposals. The evaluations will run in parallel in October and November, and the evaluation outcome will be known by the end of November. Now, in a two-stage process, we will take the winning consortium, applicant consortium, merge them with the pre-identified industry partners, and they will work together on a full proposal, and we expect that to be submitted by the end of February 2023. There is another round of evaluation in a two-stage process, and we hope to be able to complete the process of evaluation and then grant agreement preparation with grant agreement signature by July 2023. So, I could pause there if there are questions, because that was quite a lot of information on our calls.
Absolutely. Thank you very much, Hugh. And the questions are coming in quite thick and fast. And I know we will have a little bit of repetition here because Hugh is answering questions as they're coming in. But I think some of the areas are quite complicated, so it's worth, some of them do bear repetition. So we have a question regarding how can people find partners, especially small organisations, younger researchers who maybe don't have a big network yet?
I'll actually touch upon that in the final part of my slide with some guidance and some advice.
Splendid, so just bear with us. And how can people find partners, especially those, again, similar sort of question, I think, echoing that, how smaller partners can find. Another question is it possible for a regional body to become a partner? And that's from Antonella Polazzi, who is from the Tuscany region, so I guess has a vested interest in the answer.
Well, my understanding is that if you are a legal entity, you are able to apply to an IHI call. So even if you are a regional body, that should be possible.
Is there a link between IHI and key digital technologies joint undertaking in medical technologies? Patrick Boisseau wants to know what the link might be.
That might be a question that we could touch upon in the general discussion because there are links, and we can go into more detail with probably Pierre, if that's okay.
Okay. Thank you for the question, Patrick. Bear with us, we will get to it. Another question from Anonymous says, we're a new hospital, a university hospital, seeking to become an active partner in calls. What advice do you have for us to meet or get in touch with potential partners for a collaborative application?
So that touches upon a few of the points that I want to make in the second part. So I think if the questioner can be a bit patient, and I'd be happy to come back and answer that at the end once I've actually gone through the information, because we understand it's not so straightforward for partners who are new to the scheme, and particularly when you have a broad range of stakeholders to identify. And I suppose the one bit of advice I would give to everybody would be you need to start building your network before we've even thought of a call. So you need to be putting in the groundwork and doing the legwork yourself, and trying to establish small collaborations here and there. Maybe start off on a smaller scale in terms of finding local academics, local universities in the case of this hospital. But I cannot emphasize enough that networking and establishing your network will be really key to success in the health space going forward.
I think very good general advice there, Hugh. Just a couple of quick last questions. We have a question from Dimitar Georgiev asking, will there be separate calls for medical devices development, drug development and digital health developments in the non-competitive phase, or will there be syndicated calls?
So the approach, as Pierre laid out, and I think as you saw with our objectives, is to foster collaboration and integration. I will never say we will never do it, because you never know what the future will hold. And we may do something specific in diagnostics or devices or something like that. But the philosophy is not to maintain silos. The philosophy is to break down silos and to really foster collaboration between the different partners and the different stakeholders. And I think broadly that will be the thrust that will run through all of our calls. And
a final question now before we come back to your presentation. Richard Price has asked, what is the reasoning for the new requirement on increased in-kind contribution?
Well, again, this is probably more of a legal, and so they should ask the people who established the regulation. But from our perspective, we are a matched funding model. And so if you move to running more single-stage calls, you don't have any sort of control regarding in-kind contribution. You run the risk of imbalances. And then this can quite quickly become questions that we receive from auditors and also European parliamentarians, because we are meant to maintain this matched funding and equal contribution from public and private partners. I think, as you see with IHI, there's an evolution towards more bottom-up approaches, so more single-stage calls. And therefore, this has been introduced as a way to try to ensure that the balance between public and private contributions is maintained across the lifetime of the project.
Well, thank you for that, Hugh. Those of you who are sending in questions, stay with us, because we will have another round where we will talk to both Pierre and Hugh again about the questions you're sending in. I know there's a lot of them. But Hugh, let's go back to you and hear the end of your presentation.
So thank you, Jennifer. I just have a few last slides and a few things to go through. You might have got quite, some of you may have got quite excited when you saw the slide, potential future topics. And for those of you who have already been to our website, you will actually be aware that we've put up some topic ideas or themes, short summaries of where we think we will be launching topics in our first calls. Voila. So currently, we have 4 ideas or themes that we think are suitable for a single stage call. I'm not going to go through them in detail because they still have to be finalised and discussed with the Science and Innovation panel. And of course, whenever we launch a call, we will always do webinars to help explain what the expectations from applicants are in these areas, as well as explaining our rules and procedures in more detail. But it's just to make you aware that we already have some ideas that we have captured, published on our website, and that these will be discussed with the Science and Innovation panel. And everything goes to plan. You should see topic texts that will be launched in our first call in June. And likewise, we have some ideas for 2-stage topics, and there are 2 of them. Again, these have to be discussed more in depth with the Science and Innovation panel. And as I explained before, whenever that discussion takes place, we will put draft topic text onto our website. But there's a little bit of information that an amuse-bouche is available on the website to give you an indication of the directions that we are probably going to follow and what should be included, if everything goes to plan, in our first calls to be launched in June. So I now come on to this point that I think many of you who are new to IHI or you're new to trying to collaborate more widely across Europe, you encounter. And those questions I really recognise because we get asked them all the time. We know that one of the biggest hurdles to actually applying to one of our calls is forming your consortium. And we cannot deny that applicants who are established and have established networks, they will have an advantage when it comes to building consortia because they already have their network, and they, when they see the objectives of a call, can go and pick who they might need to collaborate with and submit an application. We also recognise that we're now going beyond our usual stakeholders that many of you have been used to in the past, and we're now heading towards a much broader range of companies, academic areas, technological areas, and into healthcare itself. So this challenge will be all the more important for you all. Now, you have to understand that we are an implementing body, and it's very important that when we run our calls and evaluations, we remain impartial. And this is why we cannot ourselves get involved in forming consortia or trying to find partners. There is a partner search tool that's available on the portal that I included a link for. So you can actually go there and register your interest and try to find like-minded applicants who might be interested in the areas that you are interested, and that can facilitate networking. Of course, networking is always facilitated by a cup of coffee or a nice meeting somewhere in Europe. And we will try to organise brokerage events where we will actually bring different partners and different stakeholders together so we can facilitate that networking. We'll also try to use our info days because we always run info days, and we'll be running info days to promote IHI but also to promote our calls. And we will try to use those to facilitate networking and building consortia. And if COVID ever allows us, we would really love to have these events face-to-face because it just facilitates networking and building relationships. Beyond that, I'll go back to what I said in answer to the previous question. For those of you that are new, it's really important that you begin to network, and you begin to network beyond your normal sphere. Particularly those of you that want to go and become involved in IHI. We are becoming bigger, broader, we're covering the healthcare continuum, and therefore it's incumbent on you to try to make connections outside of IMI with partners, and for you to establish your own networks. I know it's very difficult and I know it takes time, but it's unavoidable, I'm afraid. Now, in addition to working with the European Commission and industry partners on the development of topic texts, we will also be welcoming ideas from the wider health and the research community. So if you think you have an idea that will be great for inclusion in an IHI call or an IHI topic, you will be able to submit those to us. But please remember, your ideas have to demonstrate how they would help the IHI programme achieve its goals. They have to be aligned with the Strategic Research and Innovation Agenda, and they also have to address the point of why do you need to do it in a cross-sectorial public-private partnership. We will assess the ideas and with the Science and Innovation panel and give feedback. Now, we are currently working on a platform and procedures that will make it easy for you to submit call topic ideas. It isn't available yet. We still have a bit of work to do, but once available, we will publicise this, put information into the public domain, and of course it will be via our website. So please keep yourself up to date with what's happening at IHI. So, I come to my last few slides in terms that summarise how you might get involved in IHI. We have talked about the founding industry members, and I just want to remind you all that if you're a company or an organisation that works in one of the areas of our members, you're always open to join one of these industry trade associations. This might be a route for you to follow to go and help influence the work of IHI. For those of you that are more interested in participating on the contributing side, but at a project level, you will be able to apply as an IHI contributing partner, as I described. Our call for expressions of interest to the Science and Innovation panel is open, and you can get information on our website. I've described how you can help us with our evaluations and project reviews, and I've also explained how you can become a part of our patient pool. I've also touched upon how you may propose new ideas to the new programme, and as I said, when this portal is ready, we will put that information into the public domain, and we're very interested in hearing from you. Of course, many of you will be interested to apply to IHI calls, so we always update our website with the most recent information. There are some little summaries there that give a flavour of the topics we expect to launch in our first call. You will find information on open calls, and if you hadn't realised, we don't have a call open yet. We hope to launch it in June of this year. And when it comes to your actual application, you should apply through the Funding and Tenders portal. I've already mentioned, and we've already discussed with your questions about how to build networks and collaborations. So we would really encourage you to participate in our brokerage event and info days. And these tend to be launched around the call launch. And whenever our next events are planned, of course, we will keep you informed as well. If you're interested in reading the Strategic Research and Innovation Agenda in detail, it's available on our website. For those of you who are so inclined, you can actually read the Model Grant Agreement from the Commission. It's actually available on their website as well. And I'll just re-emphasise, as we move through this transition phase of establishing the different structures and our different processes, information will be put out into the public domain on a regular basis. So you can keep up to date by checking on our newsroom, or I would recommend you to actually sign up for our newsletter, because not only will you get key dates, key events, key things that are happening within IHI, you'll also find out about key results that have been generated by our projects. And finally, you can always follow us on Twitter, LinkedIn, and different social media accounts. And with that, I would thank you for your attention.
Thank you very much, Hugh. And you mentioned Twitter. I'm just scrolling through the dozens and dozens of tweets and welcomes that people are sending out. They're all very excited about this and sending their best wishes, as well as I mentioned, certain questions. So please, if you want to join me here, we will have Pierre still with us. So I will launch straight into a lot of these questions that we have coming in. Pierre, perhaps I can turn to you first. This is from Tomasz Mroz, who said that you mentioned an important stakeholder group, the SME. What about mid-caps? Is there a big gap between SMEs and large industries?
Well, there is quite a significant gap, but I mean, we would like to attract the mid-caps as well. Lots of opportunities there. Under IMI, I guess not that many mid-caps were involved, but there's nothing to say that, and I think Hugh was very clear in terms of they can be in single stage calls, they can be part of the consortium that can potentially request funding too. So nothing against, we would welcome their participation.
And I have another question from Rob Drummond, just asking for clarification, saying, do I understand correctly that members from industry associations cannot become panellists?
So in the construction that I showed, industry associations are actually represented. So there will be 4 panellists on the Science and Innovation panel that will come from our members. So what we are looking for through our call are really for the scientists, the academics, the researchers, and also those involved in healthcare. I think if this person is in a trade association, they should probably contact us at the office so that we understand what sort of body it is, who controls it, and then we can give a much more precise answer. But generally, we believe that in the Science and Innovation panel we already have the representation of industry, and we're looking for this independent voice coming from the wider scientific and healthcare community.
Now this question is multi-part, so perhaps both of you can comment on it, but Pierre, I'll put it to you first. Seeing that this is the 3rd such programme, can you share what you've learned from previous successes and failures or challenges perhaps of IMI in terms of making efficient use of public funds that result in a real concrete benefit to the public? And can you elaborate on what kind of oversight there will be on the budget?
So on the first part, I think we have obviously learnt an awful lot after 14 years of IMI business and over, I think, 170, 180 projects. And there are themes, and I tried to touch on those in my opening remarks, in terms of there are clearly specific topics that lend themselves to public-private partnerships. And these are topics where we really need to incentivize industry to come and invest in this R&D. And this could be, as I say, market failures like AMR. It's very challenging for companies to invest in new antimicrobials when there is clearly no market for them. So the rules of the game are not there, the traditional rules. In addition, I think there are areas like neuropsychiatric disorders and other things where these very, very complex scientific things we see with Alzheimer's disease, very challenging to get new medication into the arena. So I think those, and I think we've been focusing on those. But in terms of the impacts, I think you can see from years ago we had huge investment in Ebola vaccine development during the epidemic in I think 2014, 2016. And a lot of that work then had huge impact on response to COVID, including one of the major vaccines that's in use. So I think these are the kind of things where where the public-private partnership paradigm really works. And then the last piece of the question was?
What sort of oversight can we expect on budget?
So the oversight is at multiple layers. Ultimately, the European Parliament. So once a year I go there. They base their discussion on the European Court of Auditors, which audits us every year. And we have to have a clean opinion in order. So that's the oversight. But at each governing board meeting, we go through extensive budgetary items so that the governing board at the IHI level understands that hopefully our internal control systems are working, our processes are working, it's under good sound financial management rules and so on. And that is, it's a sort of guaranteed then by the positive opinion of the European Court of Auditors.
I'm going to try and group some questions together because we have an awful lot to get through, and I'm conscious that in the time we have this morning we might not get to all of them, but I do again want to reassure our audience that these questions will be answered if you contact us, or we'll try to get as much information out there on the website as well. I have just a general question on calls again, wondering whether we can expect communication or dissemination focused calls, this idea of stakeholder engagement and matchmaking activities. Is there going to be any work done on that? Helen Deval is asking that question.
So I think it's a very good question. Currently we don't have any plans, but you could foresee a situation in the future where it would make sense. And this would fit with the general approach under Horizon Europe, where impact, dissemination, exploitation, and really delivering things that patients need has a much more prominent role than under Horizon 2020. So currently we have no plans, but I'm sure we will discuss some approaches like this in the future.
Well, on a related topic about getting more people involved, Jennifer McIntosh is asking, how are children and young people involved in the patient pool?
Well, that's a great question, and there are some limitations in terms of risk to those young people and how that is organised, and so I think that maybe there's an approach where we could have a tandem parent-child, carer-child piece, but I think it's a great question, and since we did a lot as well in the pediatric setting, I think it's an excellent question.
And it chimes very well that this is the European Year of Youth, so we have to make sure we bring them on board as well. I'm just going to use a couple of final questions before we wrap up. But again, I do want to ensure our audience that we will hold detailed, dedicated sessions in the form of Q&As as we get closer to calls. So the information will be available. This is the launch. You can't answer all the questions in the launch. But we do have a question from Daniel Spichtinger asking, how will IHI deal with data sharing and with making data fair, the findable, accessible, interoperable and reusable? Hugh, do you want to take that one?
Well, I mean, we dedicated a lot of effort and resource under IMI2, and we had specific projects. We also had projects that were reaching out to other projects and taking the learnings regarding data. I think it's a core part of the FAIR principles of data management. So I can't give a specific answer of what we're going to do as of today, but FAIR principles are a core part of the approach under IHI, and data sharing, collaboration, information sharing. So that will be one of the pillars as well of the future programme. So I think we will be aligned with making sure that the data and the information that is collected will be disseminated as widely as possible.
And then to finish up, another quite general question rather than these nitty-gritty questions which can be answered on a bilateral basis. Are there any changes already expected to the proposed potential topics? So we've talked about dissemination questions, but can stakeholders still influence this? And is there an opportunity to broaden the scope for first calls, and how best to get involved in this discussion? Andrea Zulem de Schwarza wants to know that.
Great question. So I think there is, but everything will have to go through the Science and Innovation Panel. So I think, as Hugh described, the Science and Innovation Panel becomes the gatekeeper, if you like, of a lot of these things. And so, but I think the topics, as Hugh said, that they're just ideas at the moment, and they can be molded, and we're hoping that a large group of stakeholders will be able to participate in that molding.
Well, thank you very much, gentlemen. It's been hugely comprehensive. Thank you to the audience. Those are great questions, and we will do our best to get individual answers to those people who are specifically asking these questions. We're going to take a short break now, just 5-10 minutes, so you can grab a coffee or stretch and stretch your legs, and come back to us at 12 o'clock for our panel, where we're going to introduce you to the partners and supporters of the project. So it's going to be people from the European Commission, from those various other partners that we mentioned, representatives from the European Parliament as well. So don't go far, stay with us, share on social media, use that hashtag #WelcomeIHI, and come back in about 10 minutes at 12 o'clock.